Hi, I'm Dr. Uday Kiran, laser and laparoscopic surgeon at Vivekananda Multispecialty Hospital in Begumpet. Today I'm here to talk to you about diabetic foot. Diabetes has become a clinical condition of global epidemic proportions today. If the statistics are anything to go by, it is one of the leading comorbidities to affect the population that designs the outcome of any prolonged illness. As of now, there are an estimated 72.96 billion cases of diabetes in India alone. A government survey done shows that 11.8% of the urban population in India is diabetic. So, diabetes affects all vital organs in the body. One of the commonest forms of diabetes is a foot ulcer. Almost all of the diabetics, almost 50% of them living in either urban or rural population, have a diabetic foot, which is a potentially life-threatening complication and can lead to a chronic course of treatment both for the patient as well as the hospitals. It is a lot of waste of time and money. Now, why does this happen? What is the cause for a diabetic foot or diabetic ulcer? Diabetic foot ulcers are common, and the cause is secondary to an involuntary or invisible trauma. Invisible trauma means the patient is unaware of the injury that is caused, and the factors contributing to this can be several, one of which is diabetic neuropathy. Diabetic neuropathy is nothing but reduced sensation in the extremities. Diabetes affects the peripheral nerves, also thereby reducing the painful touch sensations and pain sensations, there have been instances of patients who have had boiling water poured over their feet and they could not feel a thing just because of diabetic neuropathy. Another condition that is because of diabetes is immunocompromise. Though the reason for immunocompromise has still not been diagnosed, is still not been very clear with our clinical doctors, but good control of blood sugars has been shown to have greater immunity in diabetic patients. Also, infected pathogens seem to have an affinity for diabetic cells rather than non-diabetic ones. The third reason is microangiopathy. What we mean by microangiopathy is smaller vessels in the extremities. Those vessels are affected, thereby reducing blood supply to the extremities. The cause for this has been described as there is more glucose in the blood lining the blood vessels. The blood, these cells, which are known as endothelial cells, tend to take up more glucose than required and form more protein which leaks into the blood, thereby making it thicker and reducing the flow. Lesser the blood flow, lesser the oxygen content in these areas, which promotes further infection. The fourth and the last possible reason for increased localized glucose content in the tissue. This causes promotion of bacterial growth and thereby further increases the infection rate. Now, what can a diabetic do? Diabetic foot care is an essential education that every diabetic should acquire the moment they are diagnosed with high blood sugars or diabetes. Basically, there are a lot of different types of footwear that are available and what to apply on the feet. All these, there are several solutions that you can do. There are various options available in the market to deal with this menacing complication called diabetic foot. First and foremost is blood sugar control. Whether it is with oral medication or with insulin, we have grown in leaps and bounds with the safety of drugs available for diabetic patients to control their sugars. To all those individuals who are afraid to go on to insulin, I would recommend that insulin is an extremely safe drug because it is produced within the body itself and it can be absorbed very easily, and unlike other oral chemical agents which tend to remain and cause further complications in the body. So by taking insulin, we are just supplementing what is naturally available in the body. The first and foremost thing that you can do is self-monitoring of blood sugars. Please get yourself a glucometer. Any brand, any company will do, because every machine that you use at home will definitely have some error. It doesn't have to be precise. Maintain a record. measuring at different times during the day, you can mention this record to your general practitioner, your diabetologist or your endocrinologist, and I can guarantee you that your physician will be very impressed by what you did, because we rarely see disciplined diabetics. Foot care, also there are several options in the market. For foot care, you have some footwear that is microcellular rubber slippers, which are also called MCR slippers, which are widely available in all surgical shops. These slippers tend to have this soft rubber which tends to prevent any sort of breaks in the epithelium of the skin. And also there are silicone insoles which can be used in formal footwear. This is a huge advantage to people who need to wear formal wear to work. The feet also need to be adequately moisturized on a daily basis to avoid fissuring or cracking of heels that can lead to a pathway for infective agents to enter the foot and cause infections. Also, you try to keep your feet covered at all times, especially during winters, because dryness can again cause cracking. Covering your feet also promotes better blood supply to the foot by increasing the local temperature in the foot, and as colder temperatures also reduce superficial blood flow. Diabetics should also be encouraged to wear footwear indoors as well as outdoors to prevent inadvertent injury to the feet. Coming to a doctor's perspective of a diabetic foot, it is one of the most commonest conditions that we come across as general surgeons and foot surgeons. There is a speciality separately for diabetic foot known as podiatry. There are specialized foot and diabetic foot surgeons called podiatrists these days, but they may be inaccessible to a lot of people, especially in smaller towns and smaller cities. So, in order to deal with anything related to the feet, it is always best that the patient undergo certain educative methods to treat themselves first and then approach a doctor. As the blood sugars become higher, it becomes more and more difficult to control infections. It is a situation that demands a simultaneously multidisciplinary approach, wherein a physician, that is either a general physician, a diabetologist or an endocrinologist is needed, a general surgeon or a foot surgeon or a podiatrist is needed, a physiotherapist is required, and a dietitian is needed. All these people together can bring about a good outcome in a patient with a diabetic foot. I have seen patients with diabetic foot, some of them just requiring normal medication, some others just requiring small amputations such as amputation of the toe or the forefoot. But I've also seen patients who have ignored this condition and have succumbed to it. So when you are a diabetic, make sure that you take care of your feet. All the points that I mentioned above are very important and will definitely give you a better result every single time you know someone who has diabetes. Please tell them these points.